Thanks for joining us for Khari Free at Last on Bounce 23 TV. I'm Khari Inahara. According to the U.S. Surgeon General, the rate of mental depression amongst African American women is 50% higher than Caucasian women. The truth is, mental illness and depression has become increasingly normal for millions of African Americans. Joining me is TalkTainmentRadio.com host Earth Jallow, Dr. Alvin Pelt, and the Reverend John Coates. Good gracious sakes of life, 50% higher. Why?
Well, I don't know if I necessarily agree with that.
Surgeon General said it.
Surgeon General may not look at it from my perspective. So there are a lot of things that we consider depression.
You disagree with the Surgeon General?
Do we call that clinical depression? Do we call that clinical depression? There was a study by National Institute on Mental Health in 2007 that looked specifically at black patients, black people in general, and we have a lower than average rate of depression. Our rates are lower than Hispanics, our rates are lower than Caucasians. However, when we do get depressed, it's more severe, and we tend to go treated, and it lasts longer, but the rate itself is actually lower. We're more resistant.
Wait a minute now, resistant? Oh, wait a minute, I'm gonna come back to that. Reverend Coates, wait a minute, what am I supposed to believe? Now, the U.S. Surgeon General says 50% higher. Reverend, Dr. Pelt, who is a psychiatrist, says no, not necessarily. Wait up a minute, not necessarily true. We have a greater resistance. Is that true?
Well, I tend to believe the doctor that I know, and that's Dr. Pelt and not the U.S. Surgeon General. And maybe the U.S. Surgeon General's office needs to take a deeper, more in-depth look at how depression affects our communities and which communities it affects.
Well, black women, are black women more depressed than anybody else?
From my experience, I think that a lot of us are depressed, and we handle it differently. A lot of us self-medicate, and a lot of us don't report the depression, so we don't go to the hospital and, you know, take the drugs and this, that, and the other.
So marijuana when we wake up, marijuana when we go to lunch, marijuana when we go to bed. Is that how you fight depression?
A lot of times, yes. Alcoholism, other drugs. It's not just, you know, the marijuana. It's other things as well.
So you're saying as a result of depression, a lot of women are on drugs?
I think so, yes.
What kind of drugs? Cocaine, alcohol?
Some cocaine, alcohol, marijuana.
Is it that bad?
It's bad out here for us. It is.
You just
Everybody
may be on the
knows
drug that you can afford.
Exactly.
as well.
What do you mean on the drug
well,
you can
you know,
afford?
that if you're an everyday working, trying to survive, pay your bill American, you know, the cocaine might not be available to you, so you might get the crack instead.
But how does a drug deal with depression, Dr. Pelt? I mean, why do I need to take a drug? It seems like I get worse.
Drugs are temporary feel-good, and it doesn't matter what class of drug you're talking about, alcohol, marijuana, cocaine, they all make you feel good temporarily.
Temporarily means what, overnight?
Hours.
Hours? And so, therefore, the next thing, it seems like once you do alcohol, you get more depressed after you finish with it.
That is correct.
It's a depressant, right? Not a stimulant.
It is depression.
All right, so if it's a depression, then why? I mean, common sense would say, I need to get off the alcohol.
But if I'm depressed,
exactly.
I don't go to the hospital. I'm thinking, oh, I'm depressed. I need to go to the hospital. And then there's
when you're depressed.
But what do I do about it? How do I respond to my depression?
How do I get out of it?
People need instructions as to what to do when you're feeling a certain kind of way.
You know, the alcohol and drugs it numbs the pain, and it gets you through those next couple of hours until it wears off and you find yourself in the same situation, and then what do? You do it again.
But aren't you in a deeper situation after you take the...
No, you just do it again.
Hold on for a minute. What kind of pain are we? I keep hearing this pain. Is it physical pain? What kind of pain are we talking about?
Mental pain, emotional pain.
What is that?
Black folks got a whole lot of that. I mean,
For example?
Like economics? For one, if your finances ain't right, and if you're worried about, you know, how you're gonna feed your children, how you're gonna pay your rent, are you gonna have a place to live?
Why is that pain?
That's not pain.
That's not pain.
No, worry is pain.
No, thank you.
Okay, because
Sexual, violations.
When I worry can bring on headaches.
Absolutely.
Worry can bring on stomach disorders.
Dis-ease in the body.
That's right. It's pain. If you don't know whether if you can pay your electric bill or not, and they're gonna cut it off.
And you in the dark.
That's
no,
right.
you got a $2 for candles.
Oh, come on. Oh, you got, listen, if you've got some skills and some understandings, you mean to tell me you can't get up and find work or do work to make money? I mean, why sit around and mope?
That's another issue that leads on to depression. I don't make enough money. I work every day. I work 8 hours a day, and I can hardly afford to pay the rent, buy groceries, keep the kids fed, get them shoes. That will bring on depression when you don't have enough.
That would bring on depression?
Yes.
Or would it be because you're living a phony lifestyle trying to keep up with the Joneses? Stay right there. Don't go nowhere. But there's one solution. Take your troubles to Jesus. Up next on Khari, Free at Last. Welcome back to Khari, Free at Last on Bounce 23 TV. When an African-American female suffers a mental disorder, she is perceived as weak. And weakness in black women is intolerable. She is told, take your troubles to Jesus, not some psychiatrist. Joining me is TalkTainmentRadio.com host Earth Jallow, Dr. Alban Pelt, and the Reverend John Coates. Take your troubles to Jesus. That is the new way to handle the psychological problems. Don't take it to Reverend Pelt, who's a psychiatrist. Take it to Jesus, Reverend Coates.
It's not a new way. The black church has been there. My grandmother used to sing a song, said, I came to Jesus as I was, weary, worn, and tired.
So if you got Jesus, why you need a psychiatrist?
Because what Jesus does is, and what the church does, that's what I guess your phrase means, is take your problem to the church, is the church gives hope where people may not have hope, and the church is getting a lot better at in understanding that people aren't necessarily demonically possessed sometimes, but folks need instruction on how to cope
Earth Jallow,
with the problems that they have.
Do I take my
I know
troubles?
you don't want to hear it. I know you don't, but that's okay. That's okay.
You're not going to work
Jesus
me like that.
will help you.
I love Jesus. I ain't trying to go there. But anyway, why should the black female take her problems to Jesus and not to Dr. Pelt?
I recommend she goes to Dr. Pelt because that way he can give her instructions on how to get a better job while she's truly depressed.
Well, that's what Jesus does.
No, Jesus is, like he said, hope. Faith without work is dead. So you go and you fix the root of the problem and not just the surface issues.
Dr. Pelt.
Sometimes I take their problems to Jesus. So it's not exclusive. It's
Jesus
not
will work it
exclusive.
out.
It's not an and.
That's right.
And one or the other. Why can't you take them to both?
Because black women, when they go, and you hear it in the community, and black women are considered strong. Yes. And so when they break down, they're considered weak, and that's unacceptable. So as opposed to going to see you, a psychiatrist, they go to see Reverend Coates. And Reverend Coates says, take your troubles to Jesus. He will solve all of your problems. So why should I pay
But that's not fair, because the preachers are making referrals every
That is
day.
correct.
Every day to counseling services.
The preachers are doing the counseling.
No, the preachers, responsible
You know
preachers.
what you're saying to me?
What's
you know
that?
what you're saying to me? You're saying to me that your belief does not work, because if it did, you wouldn't need to go anywhere else.
My belief does work because it brings people through the door. And if I recognize that someone needs clinical help, I'm not a clinician. A lot of preachers aren't clinicians, so I can make reference to
the belief in Christ is not clinical? Is that what you're telling me?
It does have an effect on the mind, yes, and on the spirit.
Listen,
and on the body.
I've seen drug addicts come into church and clean up their lives.
Yes.
I've seen people who were on the streets come into church and clean up their lives. So what are you talking about, Reverend? So what I'm saying to you is that when you tell me that taking your problems to Jesus is not a solution, I'm concerned about this.
No, I didn't say that. You said that. It's a part of the solution. Sometimes people need other types of help. Maybe Jesus needs to help them in another way. And other than that, an altar call or a pastoral counseling or a sermon giving instructions or a Bible study won't help them. They need to seek professional help.
But black women are really up in the church, big time, more than men, far more than men. And yet they don't go, and yet they're still having these issues. Isn't the church working?
For me...
Don't be dancing.
Listen,
Here she go.
For me, I see a lot of women who go to church who are still sick, who still can't get along with other women, who are still doing a lot of the wrong things. For me, I think that black women should stop trying to live up to other people's standards and find a plateau that's comfortable for you, so that when you don't, you know what I'm saying, live up to other people's expectations, is not so devastating for yourself.
Dr. Pelt, what causes this high level of depression in black women?
Well, it's two origins. Sometimes it could be internal, it could be genetic, like hypertension runs through certain families at a higher rate. But in most cases, it's external. It's precipitating factors. Relationships are a really big one. If you are having troubles with your relationship, going through separation or divorce, depression is almost automatic. The other big issue is finances and job stress. So outside forces trigger depression, even if there's no family history.
What about racism? Is that real or is that imagined?
Is racism a stressful situation?
Yes.
Then yes, it is.
How does it impact black females in particular?
It affects every black person who experiences racism, because as you attempt to support your family, secure employment, when you find roadblocks, how do you handle that?
Absolutely. Another thing is we have to throw in sexual violations of women. 8 out of 10 women have been sexually violated, and that for us is huge.
No, wait, hold. I'm not saying you're wrong. What's your source?
Just reading, just studying it over, different sources. I don't have like a specific. If you want to go, you can look it up. Do the research.
When we throw out data like that,
okay,
we need to at least cite a source. What's your source?
A large, disproportionate number of African-American women have been sexually violated. And we have to take that in consideration when we're talking about other external forces that make us depressed.
Are you seeing that, Reverend Pelt? Is she saying 8 out of 10? Is it that high?
And that's Dr. Pelt. I might be a reverend.
I'm sorry.
Pastor Anaharo.
Call me a doctor.
You know what? That's an interesting question, and I may not be the best person to answer that question. Most of my patients are Caucasian.
Okay, but based on what your research would suggest, is it 8 out of 10? That's awfully high.
It seems high to me. I don't have the exact numbers, but that seems
Well,
high.
you talked about the external forces. You talked about trying to keep up with the Joneses and living a phony life. Well, I think the big issue is external forces. How many messages are we receiving from mass media, and how is that affecting how black men interact with black women as it relates to how they are
You
depicted?
blaming black men for black women's depression?
No, yes, we bear
What?
some of the responsibility.
For example?
But black men are depressed ourselves.
Wait, no, don't switch up. You are blaming black men for black women's depression. Is that what you're doing, Reverend?
No. We bear some of the responsibility, as I said before.
We don't control their minds.
But we are but we're in relationship with black women. So since we know we live in the environment that we live in, we all ought to be careful of how we interact with each other.
We control y'all's depression.
We influence.
I think that you are a big influence on it, because as a child who's been sexually violated, it's normally somebody in the home or somebody close to the home, an uncle, a father, a neighbor, a family friend. So yes, this has a lot to do with why black women are depressed. Ladies, I ain't gonna leave us out.
So you're saying that it's all our fault, Reverend and Irv.
I
It's
didn't
back
say
on
that.
us. We are the cause of everything. You mean tell me she has no mind of her own?
No,
She can't decide and control her own destiny. Is that
That's
what
not
you're
true.
telling
No,
me?
that's not
That's
what I'm
not-
saying.
that's not what
I'm
I said.
saying that if you have depressed women and you have depressed men, and we ought to interact with each other carefully.
Oh, stop being so ecclesiastical.
Thank you. Thank you. Thank you.
Hey, man, I can handle it. Up next on Khari, Free at Last. Welcome back to Khari, Free at Last. 92% of depressed African-American males are ashamed to seek help. Does depression lead to high rates of crime, domestic violence, drug abuse, and alcoholism among black males? Joining me is TalkTainmentRadio.com show host Irv Jallo, Dr. Alvin Pelt, and Reverend John Coates. Look, I can handle it, Reverend Coates. I don't need to go see the man. Ain't nothing wrong with me. Look, hey, I'm having a little issue here, but I can deal with it. Hey, I'll just man up and take care of it. Why I need to go see a psychiatrist?
Well, it's not just see a psychiatrist. I think people just need to talk sometimes and have and be able to do a download on somebody else so that you can get it out of you. So it's the issue of having somebody to talk to begin with, and then there's nothing wrong with seeking professional help as well, because and we have to get over the stigma. The stigma of it.
Is the stigma heavy in our community?
Yes, it's heavy, because we still use terms like crazy and things, but we have to get over the stigma, and when we can get professional help, let's use it. You know, if you have insurance,
But
take advantage
Dr.
of it.
Pell, if a man admits that he is losing his mind, a black male in particular, doesn't he look weak and ineffective, and didn't he a turn off to women and to other men in the community? They don't want to be around him. Doesn't he lose something?
I think that's where things go wrong. Being depressed and getting treated for depression does not mean losing your mind. That's where we get off track. When I hear that term, I think most people think about somebody who's hearing voices or seeing things that other people don't hear and don't see. That would include the category, maybe you're losing your mind, but certainly depression does not fit that category.
And so if I'm a male, I want to be seen as strong. I can handle anything. I ain't worried about it. I can get through it. And I do okay. So why would I admit that I'm breaking down, Earth?
Because
especially to you.
Because for me, if you are a strong woman and you're trying to help, you know, your mate, that's what we do, we're helpmates, right? Then to me, you look even stronger saying, babe, something is going on with me, I'm feeling some kind of way.
You. Is that what you're trying to tell me?
Hey, it's okay, men cry. Men cry. It's okay to, brothers, it's
Reverend
okay
Coach,
to cry.
let's just be honest here, because you know this is free at last, so you can be free. Men, black men crying in front of black women, come
Can
on.
I have a tissue now?
Come on. Come on.
I'm about to break down right now, but
You know the reality.
and black men do cry in front of black women, black men, and everything else. People, when you feel like crying, you feel like crying. And I'd rather see a man cry than to burst out into another form of release, which could be violent.
And what do the women think when they see a man cry?
I don't
Honestly.
think. I don't.
Let's go deep.
You know, I don't believe a woman believes that a black man is weak when he cries. I just don't believe that. I don't believe that.
Earth.
Yes.
Let's tell the truth. Do black women feel that a black man is weak when he can't handle something, when he's depressed, and when he cries? In effect, when he breaks down.
From my experience, no. No, I look at that man and the people that I know look at that man and say, you know what, that is a stronger brother because he's going to get help. He's not going to sit and suffer in silence. He's not self-medicating.
Dr. Pell, come on, let's how about if we get to what's real? Is that really? I mean, Earth and Reverend just talking nicey.
They're not just talking. I have black couples that where the man is depressed and the wife is the one that facilitates his treatment. She brings him in. She makes sure he takes the medicine. She reports back on how he's doing. It's really a sign of strength. What is weak is when you're spending your time with a bottle of Jack Daniels and you're missing days at work and the rent's behind.
Self-medication?
How
heavy is self-medication amongst black males? Pretty heavy, Dr. Pell?
Very heavy.
Really? And that self-medication includes what? The bottle, marijuana, cocaine, crack cocaine, et cetera, et cetera. Is that right?
And the new drug, opiates, pain pills.
Oh, a lot of that?
A lot of pain pills.
Wow.
Percocet, Vicodin.
Numbs that pain?
Yeah. But my concern is that that's self-medication. But in treatment, I see, even among members, a lot of people being prescribed this antidepressant medication.
Yes.
Yeah.
So do you believe that there's, well, I'm curious to see what the doctor, do you believe there's an overreach of antidepressant medication is being prescribed to people now?
Wait a minute, Rev. What was that word?
Overreach. Overreach.
Thank you. You don't want to do what that meant. Go ahead, Doc.
In our society, yes, medicines are heavily prescribed because the #1 treatment that was existing for years as therapy is hard to come by. So in many cases, we replace medicine with therapy treatment, talk treatment.
So people are being over-medicated?
Sometimes.
So you're saying that talk treatment is hard to come by?
Yes.
So
What's it called? Talk treatment?
Talk treatment.
Tell me what talk treatment is.
Psychotherapy, counseling, these are ways that you can get what's inside on the outside.
So what about exercise and changing of diet? I hear exercise when you're moving around and you're doing stuff, you know, you're releasing the good endorphins in your body, and so the depression doesn't have such a hold on you when you're doing that. Is that true?
That is true, but people depressed are terribly...
Yeah, you got to coax them out. Come on, we have to go.
Look,
Yeah,
how does depression lead to drug use, domestic violence, crime, and all those things? Is there a connection between the two, Dr. Pelt?
Yes.
What is that connection?
Well, when you self-medicate with any substance of abuse, whether that's alcohol or drugs, you release your inhibition. So if you're angry, you can't control the anger. Sometimes you lash out at the people that are close to you. That's domestic violence.
So a lot of heavy drinking and alcoholism, in particular, and drug use in our community, is related in the black males to their high rate or high level of depression. Is that correct?
And domestic violence.
And domestic violence come with it, because I know a lot of people have talked about how their fathers or their husbands have alcohol problems, and as a result of that, they get into domestic violence and a whole, but you say the core of that is high levels of depression.
Yes.
And what must be done to correct that?
Well, I think we need to be more open in how depression is treated.
And how do I know? Next on Khari, Free at Last. Welcome back to Khari, Free at Last. To kind of summarize, what are the leading causes of depression and mental illness in the African American community? And is there a difference in white and black mental health depression? How do I know when I need help? Got a lot to cover. Dr. Pelt, Dr. Alvin Pelt is here, of course. He is our psychiatrist. Dr. Pelt, how do I know when I need help, number one? Number two, is there a difference between the depression between white and black people?
The first question is when you're no longer able to function, when your performance at the job is low, when your performance at home is low, then you might need to consider being evaluated for depression. The difference between Caucasians and African Americans is that while the rate of depression is lower in African Americans compared to Caucasians, the disease is more severe and it lasts longer because we tend to go untreated.
Oh, so that means that you still believe the rate is lower, but at the same time, because we don't get it treated fast enough, it gets worse.
Yes.
And then we wind up on a lot of psychotropic medication?
Well, I don't think that is the issue. We probably should have ended up on the psychotropic medications on the early side rather than the late side, so it's more difficult to treat down the road.
But once I get on these psychotropic medications, I can't get off. That's the problem. Looks like I'm stuck to this stuff for a lifetime.
Well, it depends on the depression. Some depressions are short-term, lasting weeks or months. The doctor can put you on the medicine and taper you off. Other types of depression last lifetime.
Well, look, they're putting children already in elementary and in middle school on what they call Ritalin.
And Adderall.
And all that stuff. What are the long-term effects? Some of these children can't come off of that, and they move from that to something else when they get older.
Into adulthood.
That's a problem, isn't it?
Well, we're definitely talking about two different classes of medicine, first of all. The antidepressant medicines, and there are some kids on antidepressant medicines. But the Ritalin is a different class of medicine and for different diagnostic treatment.
Do we really need all these medications, Doc? Are we over? I mean, it seems to me that every time we look around, everybody I know has got something in their pockets or in their purse. They're going into taking something all day long. Have we become a medicated society?
Well, prior to 1960, the only psychotropic medicine available was lithium. And so most people with depression, they had talk therapy, they had psychotherapy, and they had counseling. It was readily available. Nowadays, it is very difficult to get an appointment or get your insurance to pay for psychotherapy or counseling. So I think the doctors resort to the medicine.
Are they pushing pills on us, Reverend?
Well, the pharmaceutical industry has won again. Has won again.
What do you mean?
Okay. Well, they run commercials on television, and they tell you, well, if you're feeling this way, make sure you tell your physician.
Then 6 months later, if you have internal bleeding.
They just don't sell the medication to the doctor's office, but the farm reps going from doctor's office to doctor's office to doctor's office. They're now communicating directly with you, letting you know what the symptoms are, by the way.
What percentage, if you had to guess, what percentage of the African-American population is on some kind of medication? What percentage, doctor? If you if you had to look at it.
Starting
Doc,
school.
somebody.
Starting
Reverend?
to school.
60%.
What? You think it's that high?
It's high on some type of medication.
You think it's 60%, Irv?
I'm with him because I have to start at the elementary school, junior high, and high school level. Just take that population alone.
So you think it's 60%. What you're telling me is that we are that medicated up in our community. No wonder we can't get nobody to come out to a
And
meeting.
maybe I might have magnified it, but I'm just see it so increasingly. If I ask the question, and I can be in an open church setting, for instance, and how many of you are taking any type of antidepressant medication? And there's just more and more hands that are just going up. It's amazing to me.
I have never, I mean, Doc, quickly, where are we going with all this if we don't stop it? Where are we going?
Well, we need to get more talk therapy on the table.
And that's what we got to do. Thank you to TalkTainmentRadio.com host Irv Jallow, Dr. Alvin Pelt, and Reverend John Coates. And thank you for joining us for Khari, free at last on Bounce 23 TV.